Hi, I'm Anjali,
And I'm Martha.
and welcome to Public Health on Duty, where we talk to some of the most inspiring young minds in the Philippine public health system. Join us as we talk to our guests about their stories, learn about their career journey, and chat about their wins and everyday challenges.
Well, our guest for today is Arianne Zamora. Welcome to Public Health on Duty, Arianne.
Yay! Welcome to Public
Hi.
Health on Duty.
Hello, everyone. My name is Ariane. She or her.
Okay.
Hello.
Actually, Ariane, do you want to tell us about where you studied and maybe how you wound up in DOH afterwards?
Sure. Again, Ariane here. I've been working mostly for maybe 8 years in public health. So I started really as a nurse. And so that was many moons ago. But so I started as a nurse mainly during the time when parents are asking you, what do you want to do? Maybe you want to do nursing instead. So I was really part of that cohort. No idea really what I wanted back then, but they say nursing might be a good track because it will take you overseas. Let's be honest, we want to earn more money. So after that, so nursing happened, but didn't really get into the nursing thing. Didn't really work out for me.
So you never practiced nursing?
Never in a paid setting. So it's really more of a volunteer type in a public hospital. So maybe more on that later, and maybe how I got to public health, because that's actually a big thing as well. But mainly, I don't think there's it's a fit for me. Nursing and Ariane as a nurse is not really. I think something. It's good that I realized it early on. So I decided that maybe I need something else that would steer me away from nursing. So I thought about public health, and to be honest, when I thought about public health, I thought it was community health. So just to put it out there, those two things are different, quite different. So I did a master's in UP Manila. And at the same time, I was working as well with the Department of Science and Technology. So first month working there was also my first month as a master student. And it's actually a very interesting time to be in because it's all about public health all in one go.
Right.
Seeing it at work and also in school. A very good balance, really.
So, after you graduated nursing, you went straight to DOST.
No.
Oh.
So this is really I think many people will relate, especially if you did not graduate from the 4 big schools in Manila.
Mm-hmm.
So I worked as a call center for, I guess, almost 2 years while looking for work at the hospital. So, I was looking for places to work or practice as a nurse. The options back then, I'm not ashamed. So it's 2009. So back then, there's really a lot of nurses who graduated, just graduated. And then a lot of call centers as well. But not a lot of paid jobs for nurses in a hospital, really. So I did maybe 3 months as a volunteered nurse. So maybe many people don't remember, but at some point, people are actually paying to volunteer back then.
Right.
What?
Yes. Yes.
Parang ang dami mo nang binabayaran galing sa school. Tapos magbabayad ka pa para mag-volunteer.
And on top of that, if you get hired as a nurse, your salary is maybe just a bit better than minimum wage.
Oh no.
In a private hospital.
Oh no.
And I graduated from a nursing school which had a hospital. So it's like I paid 4 years to study there and will be getting something not that great every month.
Oh no.
Says a lot about the system, right? But yeah.
And you were not attracted to the promises of like cha-ching from abroad?
Maybe if because I think many people who just graduated or maybe thinking about where they want or what they want to study would look at what their strengths or interests would be. I skipped that part and just did nursing altogether. But I realized it's really not for me. It's a common story, but I really actually saw someone die because there's no ventilator. And this is in Manila, right? It's in a public hospital in Manila. Like, I've never felt as helpless as that, time, because, maybe I can provide from my own pocket, but this is not an uncommon story. Like, I have friends who worked as a nurse and stopped because, you're just one person, really. And uh, some would probably get money out of pocket to get syringe and those
Yeah.
things.
Mhm.
That's not sustainable. And it's really also not good for mental health, I would say.
Yeah, I agree. Like that burden shouldn't have to fall on you as the healthcare provider. It should be provided for by the system.
And
Right.
I saw this as a volunteer nurse, not even a paid nurse.
Mm.
Yeah.
Ouch.
Sorry, it's a bit of a downer at the start.
No, it's okay. I mean, I think that's something that a lot of people can resonate with.
And it's a reality, I think, that people who want to get into public health
Yeah.
need to know.
Yeah. So serving you like an early slap in the face. This is how public health is.
So, Ariane, fast forward to after your MPH. You went to the DOH already?
Actually, this is a bit interesting, but the project I was with the Department of Health, and this was back in the Aquino administration. The Department of Health, the government started really putting more money into research, health research in particular. So the setting there was that DOH wanted to do a couple of studies on health systems research. Because when people think about research back then, well, most people would look at it like a clinical research, but this is a bit
Right.
different. This caters more to the needs of the Department of Health as a policy making or policy making institute, right? So they're more concerned about things related to policy and how or what they can gather from research. So they had a partnership with CHRD, also a big part of the research consortium here in
Yeah.
the Philippines. So we funded research managed projects back then that are related to health systems research. So working with DOST, Department of Science and Technology, but still more on health research for the Department of Health. So even before being a research fellow, I was working on that. And that particular program is actually the research arm of the same health systems research program. So the fellowship part is really the capacity
Right.
building side of things. Yeah.
So you were part of the research arm first before you
Yes.
became a research fellow in the
Yes.
DOH. That's interesting. Because fun fact, so Arian was part of the same research fellowship that I was. It was just that when Arian left the DOH, that's when I entered.
Yeah.
Oh.
Small world.
So what did you do during the research fellowship program in the DOH?
Right. So when I did my fellowship after doing, so maybe just a tidbit on why I transferred, because mainly it's still research, right, for health policy.
Yeah.
We were reviewing research projects, but I was feeling like instead of reviewing and evaluating those papers and coordinating, I actually wanted to get into the the action more directly. So I applied for the research fellowship arm of this program rather. And when I got in, I was first assigned under the public-private partnership unit for health
Oh.
at the Department of Health. Yeah. So many people, when they hear about PPP, public-private partnership, especially after the Aquino administration, I think even now relates it more to transportation, right?
Right.
MRT and such. But yeah, it's also applicable in health.
Yeah. I think it's really an intersectoral portfolio.
Exactly.
But from what I understand, the bulk of the work that you did more recently wasn't really research, right? What were you doing, especially when the pandemic hit?
So it's actually funny. So after my stint with the fellowship, which I did not get to complete, I did a master's in epidemiology in Antwerp.
Mhm.
Ooh.
So coming back to 2019, excited to get into research of my own research interests. So I did not really get back into the DOH just yet because I know they're interested more in different things, right? But then COVID happened.
Mhm.
So I was actually asked, got invited to join the department at the epi side of things. right?
Yeah.
So mainly involved, of course, in COVID-19. So I was working at the COVID-19 unit, leading the data analytics section for that particular unit.
Right. And can you tell us more about your everyday experiences in the COVID-19 surveillance and quick action unit back then?
Right. So for the COVID unit, really, it's since it's the data analytics section, maybe I can tell you more first about the section that I
Yeah.
handled. When I got back to the DOH, I was actually surprised because the team that I was leading was comprised more of people not from the health sector.
Oh.
Yeah, and I was really thrilled, but also curious as to how it's going to work out. So the team that I was with had physics graduates, applied
Oh.
math, and even management engineering.
Also,
What?
people from
Yes.
Ateneo, really.
Yes and no.
Mostly. Oh.
No, it's actually a very
really?
fun mix, I would say. Management
Ah.
cool.
engineering.
But in epidemiology?
Yes. And that's, I think, the most interesting part of my whole journey the last, 2 to 3 years now at the pandemic. So I was really quite concerned telling my boss back then that, Doc, I don't really know how to code. Because I think when you say data analytics and how I understand it is that you have a couple of data and then you have to do the data crunching. And I would be honest, I graduated with a master's in epidemiology, but one of my weaknesses is still statistics or really doing the quants.
Yeah.
Yeah.
So data crunching or even running programs. Still struggling with RS data if you're familiar, but getting the hang of it. But again, not my expertise. But my supervisors at the DOH were, just so okay about it. That apparently I would have some skill sets that I can use for that particular role.
Right.
Yeah. So for the data analytics section, they analyze the data that they get. And finally, if you think about the Department of Health, many years ago, is really composed mostly of doctors, nurses like
yeah.
me, maybe a couple of graduates of medical technology as well, right?
Yeah.
So it was really exciting when I learned about that, and just really curious how it would work out. You were asking about a day, perhaps
Yes.
in
A
life,
day in the
Yeah.
life of an epidemiologist in the DOH.
right?
So when you think about epidemiology, well, I don't know. When I think about epidemiology, I think SPSS, spreadsheets, numbers. But I actually don't know how epidemiology happens. Are you just like around on a computer, like typing numbers? Like, okay, this is the cases for today. And then if I put this number and compute, this is like the projection.
Well, yeah, to be fair, when I was even, asking, or maybe when people ask me, what are you studying? Even when I was still doing the master's thing. So they'd be guessing, is it about skins? Like, are you a skin doctor? Like, no, that's a dermatologist. I do understand that epidemiology is quite close to an epidermis.
Yeah.
Or something that is, I think, a fair guess would be someone who works only in epidemics, because epidemiology, right?
Yeah.
But for epidemiology, it's a bigger, it's a more broader scope rather than that. And it's not just about infectious disease, actually. For epidemiology, it's really looking at, we're looking always at person, place, and time. It's something that you would often hear epidemiologists talk about. We look at person, place, and time, and looking how these different factors sort of factor in or get associated or get correlated with health outcomes, right?
Right.
So it doesn't have to be, for me, epidemiology is also a growing field. It's not just like before when you say epidemiology is just about, say, in NCDs, smoking and lung cancer, right? You have an X and a Y and see how those two things connect. But now it's a whole bunch of things that you can also apply in different settings. So we also have environmental epidemiology, even apply it in, I don't know, climate. even. So
Cool.
it's quite broad, but I think it's quite a long discussion really. But for me, epidemiology is really understanding. It's one of our mentors did say that it's the hard science part of public health. It
Right.
guides us with the policies that we have, providing us with some tools that's quite easy to apply in order to I think have a more scientific basis, or really have a science-based approach to things to
Right.
epidemiology.
Because when the pandemic was declared, I think that's really the idea of people when we talk about epidemiology. How many cases do we have? How many? Before it was person under monitoring, there was um PUI, person under investigation, right? And how many were the close contacts? How many are sick? How many are in the hospitals? How many have recovered? So I think because of the pandemic, that's how epidemiology was seen by the public. But now we're actually learning that it's really broader than that.
Yeah.
It can include even non-communicable diseases.
Yes, definitely.
Even injuries.
Yes.
That's really interesting.
And so for the Department of Health, though, although epidemiology is broad, and in the context of this pandemic, a big thing is really focused, of course, in COVID and outbreak investigation, which is, hardcore epi as well, right? Now, say for a day in a life as a quote unquote epidemiologist. So, well, an epidemiologist can be an academe or work in research, but for my experience in the last 2 years or so, is really about handling or facing this pandemic and handling data for it. When you ask me what a day in a life would be for me back then working at the Department of Health, it actually starts the day before, right? Because you have a couple of data that you have to translate. So just a short history maybe of where your data comes from, and something that I often really explain to when I have some talks as well with stakeholders, is that the data that we analyze is not just the responsibility, I would say, of the Department of Health or the people that analyze your data.
Right.
Data point starts at the time when you give it. So, say for example, you get COVID. So you want to have yourself tested, and everything starts with a case investigation form, right? So whatever data that you have there, if you are honest about the data that you put in, if you are very conscientious of what to include, or maybe you get lazy, you're actually part of the whole data system that we have. We're just the ones analyzing that, well, even on a daily basis, the type of data that we're getting depends on all places where data gets processed or submitted, right? So that is from the person who is getting tested to the testing facility, etc., and how they are updated from time to time, right? When people tell me that, okay, did you know that this particular something is that? The first thing I would ask, I'm not being just a straight up skeptic here, but asking, who was the one who did the study? Are they part of the people that really knows their stuff, or are the people that's supposed to be included in the study actually included? Say, for example, you get a lot of data from the West, right?
Yeah.
And then applied here in the East or in the country, and you have to ask, is that even contextually true for the Philippines?
Right. Arianne, you emphasized earlier the importance of timely data, and I'm pretty sure that with your experience in the COVID unit, you had fast data coming in, but you also had slow data coming in as well. What do you think are the resources that we need in order to get timely data?
I think one of the main things that we would say is big success is the advancement that we were able to make rather for ICT solutions or innovation, really making use of digital innovation for COVID-19. You mentioned earlier the number of cases for COVID-19. And so
Right.
just imagine how many data we would have to analyze per day. Or I'm not even talking about an analysis just yet, just managing all those data, which, if
Mm.
I think even researchers would understand that the real world data is very dirty. Like, have to
Yeah.
see that many are also incomplete. So with that amount of data, what do you do? At some point, I didn't even get to work with them just yet when this happened. But one specific event was that since the numbers reached more than 1 million, and before we are used, even I think with other diseases, they usually use the most basic tool that they have, Excel, right?
Oh.
Excel, just for data entry,
Yeah.
and then just imagine one line there or one row would be for one case, and then the cases reached 1 million plus.
Oh no.
And Excel only has what? I forgot how many, but it's not more than 1 million plus.
Yeah.
So what do you do then? And even when it reached 1 million, it takes forever for that data to just be summarized. Imagine, because it's a large data that you have to analyze. So you have to also find ways in order to really get that data every day and make sure that yes, you have that data. Yes, you are able to summarize it, but also find whatever response or fix that you can do for the data that you're getting. Because it's not just about getting them; it's also about doing something about those data. Because the mantra that I've had for the time that I had there was really actionable information. You don't care about the data if you're not doing anything about it, right?
Right.
Yeah, that's true.
So timeliness is very important. But in terms of success or really, how would I say it? Maybe something that the pandemic exposed us to is some weakness or gaps in data management. And because it's necessary for us to do it, we were forced to really find ways to deliver. And that's why I was mentioning that the people I was working with my section is from, physics background or
Right.
applied math,
Mhm.
because these guys are really good at coding. Something that I would not expect from, for me at least, as a nurse, it's not something that I studied for 4 years or so,
Yeah.
right? So yeah, it's a big thing. It facilitates exchange of data in a faster way, and there is a lot of investments that can and has been made. But
Yeah.
I feel like it's a direction that is for really the betterment of not just for COVID response, but for the entire health system.
Oh, so you would say ICT and having a diverse team was really an advantage.
Definitely.
Yeah, was really an advantage. Sorry, I ate my words there. So
So
Yeah.
yeah, it's funny because it's really like investing in, I'm not going to say robots, but um, the machines helping us out, but at the same time, really the capacity of the people to do the data crunching or
Right.
do the work with the technology that we have, because
Right.
you cannot just leave the data with the computer and have them analyze it. Someone has to do the grunt work first, have the expertise to work on it at that level. And yeah, I was really blown by how fast and how well it was working. Not perfect, I would say.
Yeah.
There's a lot of birthing pains that is involved. It's still ongoing, but definitely an investment that is worth pushing for the next coming years.
So this is actually what do I say? An advertisement rather. If you're an IT student or a math student who
or an MA student,
right,
Yeah,
go to public health.
or if you love spreadsheets.
Go
I
to
love
public health.
spreadsheets.
Yeah, actually.
I really want to ask Arianne, you have a lot of wins, of course, in the Epidemiology Bureau. What were these wins that we should actually continue for UHC?
I think I mentioned, the team that we had at the data analytics section, and shout out to these people. Every day still on it.
You guys are
Um,
heroes.
Yeah, definitely. Because when we think about frontliners and health workers, again, hats off to them. But also, we have people in the background working day and night, just to give us, these information that's really necessary for us to work through this pandemic. One of the big wins, I think, for me, I'm not a part of it because I think they've been hired even before me, is really, attracting these kinds of skill set and talent to the
Right.
Department of Health and Public Health. We are moving towards, multidisciplinary approach in not just in health, but in many things. It's a system that we're trying to build. And luring or attracting these skill set is very important because we're getting a different perspective on how things can be better,
Right.
how things can be improved. And for me, even when I was leading the team, I was learning so much more from the people that I was working with. Like, oh my gosh, like coding is an important part, and people are looking at predictions, and it's not just epidemiologists working on that. In the Philippines, it's one of the main partners that we have was with Ateneo and their math experts, math modeling.
Yeah.
Yeah.
People hate math, but apparently there's a lot of use for it. So
Who knew?
and yeah, it's really quite something that also opened my mind into, really opening up the public health sphere into, people that's not just with the same skill or background as myself.
Right.
Cool.
So, to Arian's kids, pat yourselves in the back.
They're not my kids, though.
Not biological kids.
Not biological kids. But
No,
like
it
the
really,
team.
for me, it's an amazing partnership because I really learned so much from them as well. And I think it's not just with my team, but also the partners that we've had. And one thing that we should never forget is the comms part of things.
Yeah.
So it doesn't, because you have actionable information, but no one knows about it. No one
Yeah.
really understands. And we can geek out all day, all night about codes, about prediction. And if lay people do not understand it, do not get to appreciate it, I think it's a big loss as well. So if it's investment that we're looking at, do ICT and also health communication.
Yeah.
Game
actually.
changer.
And we will have an episode about health communication. But maybe you have some advice for those people who are just like lurking around and still thinking if they want to go to public health. So what would you say? Like, come hither. How how you would encourage them maybe?
Maybe looking at my experience, I think it's not uncommon for people not to know what they want right off the bat.
Mhm.
What I love about public health is that it gives you the opportunity to be flexible enough to be, get into the thick of things, understanding how the health system works, but also have the flexibility to know, okay, this works for me. Maybe I want to work tomorrow in, maybe just COVID, but really for me specifically, I want to work in mental health. And that is something that epidemiology is also interested in because it's a method of, finding out things, of understanding what relationships are of certain things. And if you're a public health person, or if you're interested in becoming a public health person, the first thing that you should do is to get into it. Like, do not even overthink it because there's so many things that you can try out. I know it's a bit, vague to say that, but for me, the freedom to do those things, not be boxed into, I'm not saying going into medicine or some other fields that's focused on the clinics is not, as helpful for the public health sphere. But personally, even when I was looking back on how things were when I was a nursing student, it's always been a topic that's commonly highlighted in health in the hands of the people. It's funny because they say health in the hands of the people by 2020, by 2020, by 20 2030 and now maybe 2040. It keeps on moving. But personally, that's been a motivation for me to get into public health. When I was a nurse, I was helping people or treating people one on one. In public health, I'm just amazed and really um, inspired by the thought that, okay, I might not be helping people do things, or heal one on one, but I'm trying to contribute to a system that would actually help people not die because there's not enough ventilators for them, or the funding for it is scarce. So I was really still looking back at that point where I felt helpless. Now it's not maybe as visceral seeing people die in front of you, but people are still dying every day. And I feel like being in the public health setting would help me have a more broader impact, right? And it's something that maybe is more um, it's something that also works with people who are creative. There's always going to be a space for people in public health and in different capacity, but because again, we're working on health system strengthening in a multidisciplinary field. So it's a very, very exciting place for me to work.
That's true.
And as I always say, pupunta pa lang tayo sa exciting part. Charot.
Yeah, we are UHC, right?
Yeah, that's something to look forward to, definitely. Today, we got really, really good conversations. And I think it's also inspiring for our listeners to get that push that, you just have to be brave, take the plunge for public health. There is a space for you if you ever had that doubt that you're not going to find something that you like in public health. It's so broad. You just have to jump in.
Well, we really appreciate this great conversation, Ariane. I mean, we've been working with you a lot. We've been asking from you a lot, especially when you were in the COVID-19 unit. And we're really thankful for you not just being here with us in public health on duty, but really your service to the Filipino people because of or during your time in the DOH.
Yes, as the kids say, #blessed to have you here. Did I do that right?
Well, yeah, thank you as well. And also happy to have, this opportunity to speak about the work. Well, not just the work that I did, but also the team that we have. Well, I had with COVID. It's, really for me life-changing how dedicated and really committed these people were. Well, I think they still are. It's just me.
Thank you so much,
Thank you.
Ariane.
Thanks, guys.
And hey, guess what time it is?
What time is it?
It's John Q. Wong Book Club time.
Yay!
Our first book is Factfulness: 10 Reasons We're Wrong About the World and Why Things Are Better Than You Think by Hans Rosling, Ola Rosling, and Anna Rosling Runlund. Preconceived notions, personal bias, outdated facts, and news bias can color how and what we think about the world. Sometimes we think the incidence of poverty is much bigger than the actual global statistical data, mostly because we apply what we see and experience when it is not representative of the actual stats. In this book, the author sought to measure our level of ignorance to help fix it and change the way we look at the world.
Yes, and we have another book, The Great Escape: Health, Wealth, and the Origins of Inequality by Angus Deaton. So Mr. Deaton is actually the winner of the 2015 Nobel Prize in Economics. And in this book, he walks us through 250 years worth of studies on how the world is healthier and wealthier, but suffers from greater inequality. So does progress actually come at the cost of inequality? The sustainable solution is more than just handing out checks left and right. Mr. Deaton's thoughtful and illuminating analysis of the world gives us insights into how we might be able to move forward to close the gap.
Both fantastic books, so don't forget to check them out. Thanks for listening to this episode of Public Health on Duty. You can find us on Spotify, Apple Podcast, Google Podcast, YouTube, and anywhere you get your podcasts.
Public Health on Duty is a joint production between Epimetrics Inc. and Big Baby Studios. Dr. John Q. Wong is our executive producer. Editing and hosting by Angeli Magdaraog and Martha De La Paz. Our producers are Abigail Tan and Antoinette Mendoza. Sound engineering and original theme music by PB Nicolas.
You can find out more about Epimetrics at www.epimetrics.com.ph or at EpimetricsPH on Facebook and Instagram. This has been Martha. You can find me on Instagram at _callmemartha.
And I'm Angeli. I am not on social media, but you can catch Martha and me on the next episode of Public Health on Duty.